The goal of this webinar is to describe how to initiate, implement, and equitably enforce smoke-free policies in affordable housing programs. Our presenters will explore emerging hot topics, including outreach and education, equitable compliance-focused enforcement, and drafting comprehensive policies. Next slide, please. So Rachel Callanan and I are both senior staff attorneys with the Public Health Law Center. I'll give you plenty of information about our organization, so I want to say more about our guest presenter. Jackie Siewert is the Assistant Program Director for Live Smoke Free, a nonprofit program of the Association for Non-Smokers Minnesota, which promotes smoke-free housing. Jackie has more than 7 years of tobacco control experience focused on building local and national smoke-free housing partnerships and providing technical assistance. Jackie previously worked in the housing industry for 9 years as the manager of a smoke-free apartment building in Minneapolis, Minnesota. I'd like to thank Jackie for sharing her time and expertise with us. Next slide, please. So the Public Health Law Center is located at Mitchell Hamlin School of Law in St. Paul, Minnesota. We are a dedicated team of attorneys, policy analysts, and support staff who work nationwide on public health policies in the areas of commercial tobacco control, healthy eating, active living, and health equity. This is our commercial tobacco team. Next slide, please. The Public Health Law Center is located at Mitchell Hamlin School of Law in St. Paul, Minnesota, and we think it's important to acknowledge that this is in the Bdote region of the traditional homelands of the Dakota people. We recognize that the land we currently occupy comes with a legacy of genocide and trauma caused by US law and policy applied to American Indians. Next slide, please. Now, when we're working with policy, we have to remember that people are differently situated and the same policy approach may not work perfectly for different groups of people. Smoke-free affordable housing policies are one example. If a policy increases housing insecurity among people of low socioeconomic status, then it is not effective from an equity standpoint. Next slide, please. Housing is one of the crucial social determinants of health. Stable housing is one linchpin to aligning other social determinants of health. So the last thing we want to do is put people's housing in jeopardy with the implementation of a smoke-free policy. That's why most policies ensure that eviction is truly a last resort. The presenters will discuss enforcement plans that will help preserve housing stability for all multi-unit housing residents. Next slide, rather. Today, we will be using the term commercial tobacco, and you will see the term commercial tobacco frequently used in Public Health Law Center's resources. There are very important cultural considerations when forming commercial tobacco control policy that respects the sacred nature of tobacco as it may be used for prayer, offerings, and purification. We strive to respect these important differences in the way these products are treated in our model policies and throughout our work. Next slide, please. So what we do at the Public Health Law Center is provide legal technical assistance, and that is distinct from legal representation. So it can include doing legal research into various issues related to public health law and policy, assisting with policy development as long as it doesn't cross the line into lobbying. We have lots of publications that are available on our website, and we'll describe some of those in greater detail. We can provide trainings that can be live or be a webinar like this. And the things we don't do are directly represent clients, for one thing. So the information that is provided to you here today does not constitute legal advice or representation. If you have a specific legal question, you should contact an attorney who is licensed in your jurisdiction that can represent you. And we don't lobby elected officials. Next slide, please. So that's all for what I want to say here, and I will turn it over now to Jackie Siewert.
Thanks, Mike, and thanks to the Public Health Law Center for inviting me to join you on this webinar today. My name is Jackie Siewert. I work with the Live Smoke Free program, and you can go to the next slide. So Live Smoke Free is a program of the Association for Non-Smokers Minnesota. Just like the Public Health Law Center, we are located in St. Paul on the traditional homelands of the Dakota people. We are a member of the Minnesota chapter of the National Association of Housing and Redevelopment Officials, also known as NARO. And our goal at Live Smoke Free is to increase the number of smoke-free housing opportunities here in Minnesota and nationwide. Next slide. So I want to just start by quickly grounding everyone in the benefits of a smoke-free policy. I won't spend too much time here, but obviously healthier living is the number one. This goes for not just residents, but also for guests of the building, staff, and even pets. We know that there are market advantages to having a smoke-free building. Most people are non-smokers. Here in Minnesota, the smoking rate is 14%. I think nationwide, that number is pretty similar. So, 86% of people are non-smokers and looking for smoke-free housing. And some smokers are also preferring smoke-free housing and looking for that as well. So there's definite demand for smoke-free housing. There are reduced costs to having a smoke-free policy. I think a lot of us have seen some of those really dramatic photos of nicotine-stained walls or cigarette burns and things like that. So money to be saved there. There's also the reduced fire risk that goes along with a smoke-free policy, reduced legal liability, fewer complaints from residents, potential insurance savings, and just eliminating the cost of any sealing or ventilation treatments that you may attempt to use to mitigate secondhand smoke. So lots of benefits to having a smoke-free policy. Next slide. Now, the problem that we're talking about today is secondhand smoke. Secondhand smoke is deadly. As we all know, it contains thousands of chemicals. Many of them are toxic to humans. The Surgeon General has warned that there is no risk-free level of exposure to secondhand smoke. So if you are smelling that smoke, you are breathing in those toxic chemicals. And it really does impact pretty much every part of your body. In kids, it can cause, respiratory infections, asthma attacks, sudden infant death syndrome. In adults, cancer, heart disease, stroke, among many, many other things. Go ahead to the next slide. So the problem with secondhand smoke in housing is that it drifts from one unit to the next. Now, in the United States, 1 in 4 people in the United States live in multi-unit housing. And so that smoke is impacting 1 in 3 residents of multi-unit housing. They're involuntarily exposed to secondhand smoke in their home. Next slide. The American Society for Heating, Refrigerating, and Air Conditioning Engineers, also known as ASHRAE, has said repeatedly that the only means of effectively eliminating the health risk associated with indoor exposure to secondhand smoke is to ban the smoking activity. So there's really no way to ventilate a unit or seal a unit off or use air purifiers or anything like that. The only way to make sure that the air is clean and safe for everyone to breathe is to not allow smoking in the building. Next slide. So why does smoke-free affordable housing matter so much? Well, the main reason is because not all groups of people have equal access to smoke-free air. Now, if you look at the chart on the left there, there are a couple of things I want to point out. One is that people below the poverty line have a much greater exposure to secondhand smoke than people above the poverty line. And then renters are also experiencing higher exposure to secondhand smoke than people who own their homes. So smoke-free housing or affordable housing is so important because it's protecting the people who need it the most from secondhand smoke exposure in their homes. And it addresses those disparities that you see in that chart. Now, I also do want to quickly point out, and we'll talk more about this, but HUD does require smoke-free policies for all public housing nationwide. So in those units, smoke-free policy is not optional anymore. It is now required. Next slide. So I want to just briefly review some common types of affordable housing because sometimes this can get a little confusing. So I just mentioned HUD's smoke-free public housing rule. So when we talk about public housing, we're specifically talking about government-owned properties, and those were all required to go smoke-free in July of 2018. Now, there's another common type of affordable housing that's referred to as Section 8. Now, anytime you're talking about Section 8, you're talking about privately owned properties. And there are kind of 2 buckets here for Section 8. One is project-based Section 8. So this refers to when the subsidy is given to the housing provider, and then they in turn offer low rental rates for their units. And then the other bucket is the housing choice voucher program. It was formerly referred to as Section 8 vouchers. This is where the subsidy goes directly to the renter in the form of a voucher, and then they can use that to pay their rent to that private landlord. So Section 8, there is no requirement for those buildings to have a smoke-free policy, so it is voluntary. There's also something called naturally occurring affordable housing. Sometimes people refer to it as NOAA, the acronym. Again, these are privately owned units, not subsidized by any government program, but the rents are still low and considered affordable compared to regional market rates. And again, these units are not required to have a smoke-free policy. Next slide. So how to connect with these affordable housing providers? Well, obviously the first and easiest way to do this is direct outreach. Look them up on Google, find a phone number, find an email address if you can, introduce yourself, let them know that you're available to assist, what kinds of resources you have, etc. You can also look to see if there's a local affordable housing coalition in your area. Affordable housing is a big issue in many cities across the country. So these kinds of coalitions are becoming more and more common. You can join your local or regional chapter of the National Association of Housing and Redevelopment Officials, or NARO, and they frequently do educational events for their members. So I would encourage you to ask about any speaking engagements that you may be able to take advantage of. You can also try inquiring with city rental licensing programs. They will often keep a list of all of the housing that's licensed in their city, and they are usually pretty willing to share that information. That won't necessarily get you affordable housing, but it'll get you somewhere to start. I'd also recommend just inquiring with your local PHAs. A lot of them don't just operate public housing, but they will run the local Section 8 program, or may have other housing programs that they're running. So you can check in with them to see if there are opportunities for outreach through your PHA. And then I would encourage you to leverage existing partnerships that you already have to make connections. Just think about who you've already got a partnership with, who do they know, maybe they have some ideas or people they can connect you with. And then also think about social service agencies as well, who may be working in or with affordable housing. Next slide. So to start the conversation, make sure you know who the decision maker is. Make sure you're talking to the right person. Sometimes it's a on-site manager. Sometimes it is a regional manager, or maybe it's the company CEO. So make sure you know who that person is. And then listen and offer support. So ask them what concerns they have about smoking on the property. Offer them information and resources, and then meet them where they're at. And what I mean by that is that if they're not ready to adopt a smoke-free policy, that doesn't mean that, there's no way that you can work with them. They may be interested in providing cessation information for their residents. They may also be willing to start small and maybe try some sort of voluntary approach to getting residents to smoke outside of the building. So just kind of think about, where you might be able to meet them. Next slide. So to make the case for a smoke-free policy, focus on the benefits, all the benefits that I mentioned on that previous slide, especially the equity aspect in affordable housing that can resonate a little bit more than it might in market rate housing. Be prepared to address common concerns. What we commonly hear as concerns are concerns about smokers' rights, managers' capacity to implement and enforce a policy, and turnover rates. And then it can also be helpful to share testimonials or examples of other affordable properties that went smoke-free and how that went for them. Next slide. Some key messages. Smoke-free policies protect residents, guests, and staff from secondhand smoke, keep the rents low, help you save money, reduce maintenance costs and fire risk. And then I also want to point out at the bottom, that last one, make sure that as you're kind of delivering all of these messages, that you focus on secondhand smoke as the problem, not smokers. A lot of times there's this impression that if you go smoke free, that the smokers have to move out or they have to quit smoking. And that is not the case. They are welcome to stay in their homes and encouraged to stay at the building and just comply with that new policy. Next slide. So one thing to think about when you're working with affordable housing is that resident service providers or social services can be a really excellent partner. A lot of times affordable housing will have resident service providers working in the buildings, and they can really be helpful in terms of reinforcing messaging. And they have a different approach when it comes to compliance and working with residents than management would, simply because they're not the rule enforcers, they're more of a partner. And there's just a different power dynamic there. So they can be really helpful in working with residents on compliance issues. They can help identify strategies for residents who are having difficulty complying, and then they can also be helpful in connecting residents with cessation resources. Next slide. So anytime you're putting a policy in place, if you want it to be successful, it's really important that that you think about resident engagement and giving residents a voice in that policy. That will help build buy-in and build resident trust, and they will be more likely to comply with the policy than once it is implemented. So a few ways that this can be done, and a lot of these are a little bit easier to do when we're able to safely meet in person, but hosting educational meetings and inviting subject matter experts as partners to come present can be helpful. Conducting pre and post policy surveys to get resident feedback and let them, share their concerns. You can hold a smoke-free kickoff event or an anniversary celebration. Involving residents in any policy changes or updates that you may be implementing, connecting them with Cessation Resources, and any chance you get, try to really amplify those resident voices. They can be a great messenger to their peers. Next slide. These are just a few examples of some resident engagement that's happened at some public housing here in Minnesota, some celebrations, a survey drop-off table, some mini health fairs and things along those lines. Next slide. So I mentioned cessation a couple times, tobacco cessation, but I want to emphasize that it's really a key piece of any smoke-free policy. And that's because 68% of people who smoke want to quit. And these policies can actually motivate and help them to do that. So promoting cessation resources in smoke-free housing supports compliance and resident well-being. And then also, partnerships between housing providers and local public health or community organizations can really make cessation more accessible. It can make those programs easier to implement for the management, and then bringing those things closer to residents makes it easier for them to take advantage of those resources. This image here is from a poster campaign that was done in Minnesota in a public housing building, and they posted these throughout the building. This is one of their own residents who quit as a result of the smoke-free policy. Next slide. A few more examples of cessation promotion that I've seen. First, on the left there, the Tips from Former Smokers campaign has been going on for 10 years. But this is, they have tons of resources online, posters and digital things, and kind of whatever you might want. And they also do have some messaging about secondhand smoke in that campaign as well. So some resources there from the CDC. I've also seen lots of affordable housing newsletters where they'll kind of regularly put something in there about the local quit line or a reminder about the smoke-free policy. And then there on the right side was from an event at an affordable housing building in Minneapolis, where on the Great American Smokeout, they had some materials out for residents to build their own quit kits, which is just a little box filled with things to keep your hands and mouth busy when you're having a craving. Next slide. few more cessation resources. This blue card on the left is from the Smoking Cessation Leadership Center. It's palm sized. You can order those for free on their website, and those are a really easy way to get that 1-800-QUIT-NOW number out to residents, and that number will route residents to their state quit line. In the middle is a poster from the CDC. Your building is smoke-free. How about you? Easy to post in common areas or put in resident move-in packets, things like that. And then on the right side is our global directory of smoke-free housing programs. This is on our website at mnsmokefreehousing.org. And this is a listing of all sorts of organizations that are supporting smoke-free housing throughout the country. So this is a great place to look for partners. Next slide. So speaking of partners, here is a kind of a long list of potential partners that you may want to consider working with to support your smoke-free housing efforts. A couple that I want to point out: health clinics and health insurance providers. We've had success here in Minnesota working with them, and they've got sometimes people who are trained in smoking cessation, and sometimes they're willing to come out and do on-site coaching for residents. Fire departments tend to be a great partner as well. Fire departments here in Minnesota have worked with us to refer buildings to us after they've had a smoking related fire. And so that's been a really helpful partnership for us here in Minnesota. But if you have other examples of partnerships, feel free to put those in the chat. I know lots of you are doing some really innovative and creative smoke-free housing work with different partners. So next slide. All right, so I'm going to take a few minutes to talk about compliance because this is one of the most commonly asked questions when it comes to smoke-free policies. And I do want to start by saying that, like the little cartoon says, if you work hard now, it'll pay off later. What we found is that if you put in the effort to gain compliance and promote compliance now, you will spend less time on enforcement in the long run. Next slide. So some ways you can promote compliance: make sure you prepare your new residents. When they come in for a tour of the property, make sure you're highlighting that smoke-free policy from the start. Explain the policy details when they come to sign their lease. Take any questions and let them know who they can contact if they have concerns. And for current residents, make sure that you have signage posted throughout the building. You can conduct educational meetings, distribute in-unit reminders like keychains or magnets. I know a lot of buildings will send an annual or every 6 months regular policy reminder letter. You can distribute or hold a smoke-free celebration every year, or maybe every 5 or 10 years. And then make sure you're involving residents, as I said before, in any changes or updates to that policy. Next slide. A few more tips here for promoting compliance. Make sure you're using multiple formats and channels to communicate that policy. Make sure, during the leasing process, make sure it's posted in common areas, resident meetings, things like that. Make sure all your staff are trained. It's really important that everyone who works in the building knows why the policy is important and what they should do if they observe a violation. Make sure you're translating messages for non-English speakers. And then stick to positive messaging. I talked before about, the smoke being the problem as opposed to the smoker. It also helps to use the term smoke-free instead of no smoking. It has a more positive ring to it. And then also consider thanking your residents for complying with the policy. In the photo with the umbrella, this is a resident from a building where they implemented an umbrella sharing program to make it a little bit easier for residents to go outside, comply with the policy when there's inclement weather. So think creatively about ways you can promote compliance. Next slide. A few tips for addressing violations when they do occur. Follow up on complaints as soon as possible. If you're able to, be on site when violations commonly occur. Maybe do random checks. Partner with others who are working in the building. We talked about resident service providers, but anyone who's working in the building can be your partner in kind of keeping an eye on things. Make sure you're documenting all observations. Be consistent and follow your enforcement plan. And Rachel is going to go through what that might look like for an enforcement plan. Make sure you communicate back to residents who report violations. A lot of times we get calls at our office from residents who complain to their manager and then never heard anything. And so they assumed that nothing was being done when in reality, that wasn't the case. And then the last one is do your best, because these policies are not perfect. People will break the rules from time to time. So do your best to follow up on those complaints. Next slide. So to wrap things up, what does successful smoke-free affordable housing look like? When I think about it, I think of three things. One is commitment from management and staff working in the buildings to the policy, commitment to, promoting compliance, working with residents to help them comply, and commitment to following up on violations. I also think of engagement, making sure that, residents are engaged, that they know what the policy is, that they've had a voice in the policy. And then lastly is progress. I think this is the most important piece of a successful smoke-free policy, because like I said before, smoke-free policies are never perfect, but you'll know that your policy is successful if you're seeing progress. You may not have perfect compliance from the start, but if it continues to improve and get better and better, that's how you know you're having some success. I also will mention that HUD has some other examples of successful smoke-free policies in their guidebook. And you can go to the next slide. A few more resources here. The Clean Air for All, the Smoke-Free Public Housing Project has a bunch of resources and a compliance and enforcement toolkit. The National Housing Law Project has a guide to equitable smoke-free public housing. And then HUD has a great resource guide as well, along with a resource bank on their website. Next slide. This is our website for Live Smoke Free. I would encourage you to check out our affordable housing page. You can also follow us on social media or sign up for our quarterly newsletter. And I think that is all, and I will pass it now to Rachel.
Great, thank you so much, Jackie. And I want to just recognize the important partnership that Public Health Law Center has had with Answer over many years, both at a state level in Minnesota, but also nationwide. So it's just been a fantastic partnership. So I wanted to recognize that, Jackie. So I'm going to take us in a little deeper dive into the key elements of a comprehensive smoke-free policy and explore some of the options for how to structure the policy and the goal, as Jackie pointed out, the goal is to promote compliance. So next slide. So the great news is you don't need to reinvent the wheel. So many jurisdictions have used their affordable housing or subsidized housing programs as an avenue to implement smoke-free policies. The HUD rule is the most well-known example, but before the HUD rule was in place, many public housing authorities and nonprofit housing providers had already taken steps locally to make their properties smoke-free. So several states and local jurisdictions actually make adoption of smoke-free policy part of the criteria for selecting recipients for their subsidies through, for example, the low-income housing tax credit program, but also other affordable housing subsidies. So next slide. American Non-Smokers' Rights Foundation has a list of over 600 housing authorities nationwide that have adopted smoke-free policies. So this is not a new idea. Many communities have been engaged in this work, and that's a really great resource to learn about more. So finally, I wanted to point out that state or local smoke-free laws can also be a very good way to enact strong, comprehensive smoke-free multi-unit housing policies. In many states, statewide smoke-free or clean indoor air laws actually cover common areas of multi-unit rental buildings or all multi-unit buildings. Some local jurisdictions in California have gone even further and actually require that units themselves must be smoke-free. So some jurisdictions in California cover both rental apartments, but also common interest communities, condominiums with these kinds of requirements. So There's definitely some momentum building, and public policy is another way to tackle that issue. We're not going to dive into that today. We're going to focus more on the individual policies. So I do want to walk you through the key components for properties that want to create comprehensive and strong policies. Here's an outline of just a few of the things to consider. What existing laws applied. So I did mention some states or local jurisdictions have some requirements already. So, you know, monitor the developments there or existing laws. Reach out to experts in this area locally to find out what laws currently apply in your jurisdiction. Next, and I'm going to dive a little deeper into some of these subtopics. Who will the policy apply to? The what of the policy. A comprehensive policy should absolutely cover the whole range of products and substances, including marijuana. The where, what is the scope of the policy? And that needs to be carefully considered. Will it cover the entire property, or will there be certain areas on the grounds that smoking is allowed? And then the when, and Jackie covered this really well. Clear communication early on and engagement with residents are really key factors in successful implementation of the, it have been for any type of smoke-free policy, whether it's subsidized housing or in the private market. So, and last, I'm going to touch on some examples of enforcement considerations. And, you know, as Jackie pointed out, eviction is not the goal of the policy. So we're going to talk about some of the strategies around graduated enforcement and trying to gain compliance by residents. So first, the who. So the policy is going to cover the tenant, the tenant's household, and their guests. It should also cover employees, staff, you know, everyone who is entering the property. And I want to emphasize there should be no exceptions. I know it's very tempting to provide an exception for current residents to continue smoking. But that approach really defeats the purpose of enacting a smoke-free policy, because it's going to put the health and safety of other residents in jeopardy. So, you know, really resist that temptation to say, we're just going to accept some of the residents. And, you know, in our model policies, we always put forth a comprehensive policy. So next up, what products? So our comprehensive model definitions cover pretty much the whole range of substances, devices, types of smoking materials, and methods of smoking that we're aware of or that we know are emerging and coming onto the market. And so you'll see the text box here, the definition of smoker smoking covers lighted and heated products. So there are these new products that don't actually combust the tobacco, but heat it to a point that there's a substance that can be inhaled. So it also covers nicotine, tobacco, any other plant products. I've seen hemp cigarettes out there. You know, and then of course, marijuana is another area. And some of these products may be legal in your jurisdiction. Some of them may not be legal to use, purchase, or sell, but you want to make sure that your definition is protecting all of your residents from exposure to secondhand smoke, or also covering electronic smoking devices, often called vapes these days, or electronic cigarettes, making sure that you're covering the substances emitted from those devices as well. So the next slide, I want to also talk about, there is one exception that we include in our model policy. Some smoke-free policies provide exceptions for traditional, ceremonial, and sacred uses of tobacco practiced by some indigenous communities. So you could include this important exception by including this sentence in the text box here. and putting that essentially into your definition, saying that these things are all smoking, defined as smoking. There is an exception for this use. And if you want more information specifically on this topic, I recommend the National Native Network's website, keepitsacred.org, and I included the link there. So the next is where is this policy going to apply? And the sample language I have shown you here is a comprehensive policy. So it covers the entire property. And that's what a truly comprehensive policy would do. So you'll see in the first paragraph there, all units are covered, including outside areas of a unit, such as attached balconies, decks, or even patios that are associated with that unit. It covers all indoor common areas, and it also covers all outdoor areas, including grounds, parking areas, sitting areas, pools, playgrounds, you name it. So this language would be a comprehensive covering the entire property. Now, we know that some properties want to have some form of as a designated smoking area. If you do choose to consider a designated smoking area, it should be very tightly limited. So it should always be outside, and it should be in a very limited location, at least 25 feet away from the building, any air intakes, windows, doors, so that you're minimizing possible exposure. But it should also be at least that far away, 25 feet or more away from any outdoor common areas like pools and playgrounds or parking areas. The designated smoking area should be explicitly provided in the lease addendum or the rules for the property, and it should be clearly marked with signs, even painting a perimeter, or other method of really clearly demarcating the location so that other residents can avoid exposure and not enter those areas. Before adopting any such policy, we do recommend that you check with the local and state indoor air laws and clean air laws to make sure that you're complying with any requirements that might need to be met there. So next up, I'm going to talk about compliance-focused enforcement. And just a reminder, the reason that, the next slide, the reason that this is such an important component is that nicotine is a highly, highly addictive substance. And so a key principle behind graduated enforcement is to approach implementation with an eye towards assisting residents with compliance by offering assistance with cessation, basically helping them resist the cravings. Jackie did an excellent job of giving some really great examples. So, and a reminder in the next slide that a graduated enforcement policy is not a standalone component. It is a really important part of a comprehensive approach to this, so that education, signage, cessation resources are all really key components to successful implementation. So in my next slide, I just have a couple additional cessation resources. Jackie covered those in depth. And my next slide, I want to highlight a publication that we have specifically around this topic of equitable enforcement and graduated enforcement. And we have a number of examples in our publication, as well as significant background and rationale for why this is such an important approach. And, really the point is to really try to increase housing stability, avoid eviction, and, make sure that people have the opportunity to comply. The one thing I will note that you'll not see in any of our examples is the use of fines. I know that can sometimes be a common way of enforcing some rules within housing context. But in our view, that approach may have some very, although unintended, but significant consequences for especially low-income residents that could create a financial crisis for them, leading to inability to afford their medications, food, and may even amount to threatening their housing stability if they can't afford their housing due to fines that they owe. So that is a tactic we think should be avoided. So the first example I'm going to talk about is from the Bayonne Housing Authority in New Jersey. And these examples are in our publication, so you can read in more detail here. And this is a very similar to approach to Public Health Law Center's model language. You'll see that there are a series of warnings, verbal, then written, which are also paired with communication of the smoke-free policy and provision of smoking cessation resources. The cessation resources could be provided in partnership with your local public health office or healthcare providers in your area who have an interest in helping people quit. So this policy also requires that as part of the process, the head of household is required to sign the lease addendum again. And this is a good step to just acknowledge, they have to proactively acknowledge that they're aware of the policy. So it's a good practice, or some other form of official or specific recognition that the policy exists. The focus of this kind of approach is really on giving residents the opportunity to comply. However, lease termination is ultimately an option, just as with other lease violations. And I don't want to downplay that the stakes are very high for other residents who may be continually exposed to secondhand smoke. So their housing stability is also in jeopardy if they can't stay or live in their homes because of that exposure. So it's a really important balancing act to make sure that housing stability across the board is prioritized. So one more thing I want to highlight here in this version is that it does require verbal warnings. And while in non-pandemic times that might be a knock on the door, face-to-face meeting, for safety reasons, they to protect both residents and property managers, other options might want to be explored. So my next example is the Dakota County, Minnesota CDA, which requires an informal meeting between the resident and management. So I really like this kind of personal approach of like, let's have a sit down and kind of talk this through. I think that's a really good approach. And then again, during the pandemic, that might not be possible, but looking for innovative ways to do that. And of course, this example, they provide cessation throughout the process as well. So next slide, I just wanted to highlight, I'm not going to get into this because we're running out of time, but highlight a few considerations during the COVID-19 pandemic, things that you should be thinking about as you're revisiting your policy or strengthening your policy. And with that, I'm going to hand it back to Mike.
Thank you, Rachel and Jackie. That was great information. So we've received several questions in the chat. We may go a few minutes over the time we said we would end by. So if anybody needs to leave, they can, we'll stay a few minutes late to answer the questions, but if anybody needs to leave, this webinar will be recorded and is being recorded and will be archived on our website. So you can, if you're interested in the answers, you can, and need to leave, you can feel free to watch the recording as well to get to them, but we'll try to get through these pretty quickly. So Carolyn had a question in the chat. She asked if there are any suggestions around housing wanting to grandfather in existing smokers. And Rachel, I know you spoke about that a bit in terms of exceptions. So I guess maybe if you could expand on it, maybe just suggest how you would respond to arguments from housing providers that they want to allow existing smokers to continue. What arguments can you use to convince them it's a bad idea?
Yeah, I think a couple of key points on that subject. So we recommend no exceptions because A, it's not protective. So, if someone continues to smoke, others are being exposed to that secondhand exposure. So that is a priority. Second, it can create a lot of confusion around enforcement. And so if one person's allowed to smoke and others are not, that can start leading to, more rule breaking because it's unclear. It leads to lack of clarity. So I think those are the two most important, in my view, arguments that can be made.
Yeah, Jackie, I don't know if you have any information to follow up on that.
I can just add one quick thing. I've talked to a lot of affordable housing providers that have this concern where they've had long-term, really, really good residents, and they feel like they're, imposing this policy on them and it's going to, have a negative impact on them. And so I can definitely understand that perspective. And one solution that I've tried to offer in some cases is to maybe do a more extended implementation or notice period so that you are feeling like you're giving those residents enough time to either change their behavior so that they can comply with the policy, or B, figure out a new housing situation if they feel like they need to find somewhere else to live. That's just one way that you can maybe offer a solution to that problem.
There was just before we move on from this topic, there is a comment from an anonymous attendee saying, could you explain why you use the term exception instead of grandfathering? I feel it is important to be actively educating about the way the language is racist. And so just by way of background, the term grandfather clause was often used to prevent African-American people in the South from voting. So there were laws passed after the Civil War saying you can only vote if your grandfather has. So there is disturbing history around that use. We do generally use the term exception, I guess, to try to avoid using that term. So that's some of the background there. There were a couple of questions about marijuana that were posed. I'll just combine them and see if either Jackie or Rachel would like to answer. So Alicia asked if there are any ideas for how policies handle tenants who may say they are medical cannabis users. And Irene asked, how do you exempt marijuana if the state has legalized recreational marijuana? I don't know who'd like to tackle this one first.
I'm happy to jump in. So I think, first of all, the housing providers can, as far as I'm aware, any jurisdiction that has legalized recreational or medical marijuana has the ability to restrict where it can be used or smoked, I should say. And so one thing to think about is if people are using medical marijuana, there are other methods of use that do not involve smoking or vaping the products, and so do not put others at harm. So, it's not about, again, not preventing the use of medical marijuana, it's protecting those other residents from exposure to marijuana or cannabis, smoke, or vape. And so I think the other question, it was about exempting marijuana. And I think in our view, there's not a good reason to exempt marijuana because it has very similar and some would argue even greater harms, I think, of secondhand exposure for other residents. So that's why our definition is very comprehensive and covers marijuana. So Jackie, did you want to add?
No, you covered it really well. I think, we always just stick to the message that smoke is smoke, whether it's tobacco smoke or marijuana smoke. Anytime you're burning something, it can give off those harmful chemicals. So it's best to keep the air clean.
Okay, thank you both. There's an anonymous question relating to the sacred use exemption. They say, people look for loopholes. How often do you end up with people claiming their use is part of a cultural ceremony or practice? I don't know, Jackie, you have a lot of experience working on these policies. Have you ever seen that problem arise?
Yeah, that's actually an interesting question because I have not seen that problem arise. At least I assume that the person asking the question is kind of implying that they're claiming that it's for cultural use, but really it's just so that they can get away with breaking the policy. I have not seen that come up as a problem in any of the housing that I've worked with. So yeah, I guess, Rachel, have you seen that come up anywhere?
I have not. I know that it's, people are concerned a lot about that issue. And that's why I did include that link to the resources, because I think it's really important to educate yourself about what it really means to be using tobacco in a ceremonial way for, Indigenous communities. So, I think it's a good opportunity to educate yourself about it so that you can better determine if somebody is using it as an excuse or genuinely attempting to use that exception.
Okay, thank you both. Amanda says, do you have any suggestions for multi-unit housing facilities that would still like to allow smoking in the patios and balconies? We have many like this. I don't know who would like to take this one.
I can start, and I will say that this is a sticking point that I've seen here in Minnesota at some housing properties, and it's problematic for a couple of reasons to allow smoking on patios and balconies, because the smoke is going to blow back into the building. A lot of the calls that I get from renters are from renters who are frustrated that they can't open their windows in the summertime because their next door neighbor is smoking on the balcony and it blows directly into their unit. So you're really not doing yourself any favors by allowing residents to smoke on balconies or patios from that standpoint. The other thing that I've heard from our partners at the fire departments here in Minnesota is that a lot of times when there are smoking related fires, they start on patios and balconies, improperly disposed cigarettes. So I think for those two reasons, it's best to not allow it on patios or balconies, and to at least do, a 25-foot perimeter or a designated smoking area, or to make the whole property smoke free if that's something that might work for your community. Rachel, if you want to add anything, go ahead.
Yeah. In the comments, Andrea makes an interesting point. She says, I have eliminated the use of the term smoker. It implies a permanent status and one that most don't want to have. So it is a demeaning term. Smoking is an activity and does not confer a protected status to those that engage in it. Dropping this term negates the rights argument and defines everyone, whether or not they smoke, as an equal human being. I think that's an important point to make. In the comments, there's another comment relating back to the sacred use exemption. It says, remember, most cities have ordinances prohibiting burning leaves outdoors. So why is it legal to burn leaves inside, and why are there exceptions? I guess, at one point I would make is that sacred use exemptions generally are done in a way that can be done in a way too that serves fire protection purposes. So, obviously burning a big pile of leaves inside would be bad, and that's generally not what we're talking about here. I don't know if either of you have any additional points to make on that. Okay, I think that's all of there was a question submitted in advance also. I'll make this the last question. So it's, how do you prove somebody violated a smoke-free policy without going into apartments to find the source of the smoke? I don't know if either of you, Jackie, would you like to take that?
Sure, I'll start and then Rachel can add on. So this is a question that we get quite a bit, and it is possible to, show that somebody violated the policy without physically witnessing them smoking in their apartment with your own eyes. And these are things that you can actually kind of write into your smoke-free policy as so the residents know how you'll determine if a violation occurred. So some things that some ways you can do that are, if you get multiple complaints from other residents, that can count towards a violation. If you observe cigarette refuse, like an ashtray or, cigarette butts somewhere in the unit, that can count. If you're getting multiple observations from multiple different staff people. So there are a number of things that, can count towards a violation, even if you don't physically see someone smoking in their unit. And it may take a little bit more time to build up some of that evidence than if you actually observe them smoking. just kind of sticking with it and documenting all those things is the best way to do it. And Rachel, feel free to jump in.
That sounds great to me. I think documenting is the most important thing, is to keep a record of those violations.
Okay, and I know I said that was the last thing, but I've noticed there are some, I'm trying to check both the Q&A and the chat feature, and so I've missed some things. So there is a question just to confirm, so you can legally restrict the use of recreational or medical marijuana, even if it is legal in the state. And I think it is important to kind of clarify the distinction between using it generally and using it in a specific place, because some states do have laws that says you can't penalize people for using legal products. So, so obviously you probably in those states couldn't pass a law that says like nobody can use it because it's legal in the state. But as far as smoking it or vaping it, I think property managers do have the ability in even those states where it's legal to restrict where it's used. Is there any additional clarification you'd like to make on that point?
Yeah, just a bit of clarification I would make is, again, we have not looked at every marijuana law across the state or across the nation. So it's important to understand what your local laws are and what the state laws protect. And so as a general rule, marijuana and cannabis is still considered a Schedule I substance federally. So it is considered to be an illegal substance at the federal level. And so my statement was based on that reality, but I know there are jurisdictions that may have greater protections for the use of those products. So it's one of those things, if you are in a state with legal marijuana sale and use, you should check your local laws.
And finally, there is another comment in the Q&A portion. It says, they say, we suggest mediation as an option in step 4 of our enforcement strategy. We find that mediation resources are mostly free or funded activities, just trying to get secondhand smoke to be included in community resources such as mediation. So I think that's an important point as well. I think that covers all the questions and comments we've received. So I'd like to extend a huge thank you to our presenters, Rachel Callanan and Jackie Seward. If you have any questions, feel free to visit our website and contact us at publichealthlawcenter.org. And Jackie, do you have any comments about how to reach you as well, and folks that live smoke-free?
Yeah, you can find all of our contact info on our website, which is mnsmokefreehousing.org.
So thank you again, and please we have a similar webinar, but we won't be covering exactly the same information, so please attend that. That's next week. The information about that webinar is on our website as well. So thank you for your time, and have a great day, everybody.